Dr. Kelley Gebhardt is here with us taking your questions today. So this person is asking about dog food, and they say, are the average dry foods in our big stores healthy and not full of fillers? I'm talking about Iams, Purina, or Pedigree.
A lot of the foods on the shelves are very good. There are a few things you want to make sure to look for in the quality of the food. One, you want to make sure that meat is the first ingredient, not a meat byproduct. You want to make sure there are no artificial colors, preferably no sugar, minimal or no preservatives. And there's something called the AAFCO seal of approval. You want to make sure that it has, whatever food you're feeding has the AAFCO seal of approval. That indicates that it has reached the dietary requirements to be determined healthy for your pet. I think Purina, Iams, Science Diet, Eukanuba, I think those are all really great brands, but those are some key factors when you're looking for a food. Make sure to reach those criteria.
Okay. So this person is asking, our dog is outside and our dog is afraid of thunder. How can we help her move beyond this fear?
Ooh, that's a tough one, because if she's an outdoor dog, she can't get away from it, right? So it's going to be really intense for her all the time, as opposed to an indoor dog that's going to feel a little bit more secure. And some of the things we would do for an indoor dog, you might not be able to do for an outdoor dog. You know, thunder shirt, sedation, or anti-anxiety medications. If she's outdoor and unsupervised, that might not be safe for her. And she just can't get away from it because she's outside and it's really intense. So bringing her inside during thunderstorms, I think, would be point number one. And then working with your vet to establish a program to help her get less sensitive to it when she's inside, right? Even if you have to leave her outside during non-thunderstorm times, bringing her indoors might be the thing to do during storms.
And this person must have kind of like followed up. Their question was, what's the best over-the-counter option for a dog with high noise anxiety like thunder or fireworks or loud noises? I'm guessing they're wanting to know if like Benadryl or something like that will work.
Yeah, I think you're going to have to talk to your regular vet about that, because I don't really think there are adequate over-the-counter meds that are going to provide the effect that you're looking for. And making sure to get the proper medication, proper dose for your pet with your regular vet. You got to consider other health conditions and what other meds they may be on, and making sure to do it in the best way for your pet. I'd recommend talking with your vet.
All right, let's talk about snakes. We just had a venomous snake that was loose, somewhere in Raleigh. So what about snakes and pets?
Yeah, so we're seeing so many snake bites this summer. As you know, snakes are active during March through October. They're kind of moving out of their dens in March and going into den during October for the winter. And during the summer, they're out hunting. So we're seeing a lot of snake bites. Dogs usually get bitten on the nose from sniffing, or on the feet from stepping on the snakes. Cats usually are bitten on the feet from pawing at the snakes. Copperheads are the #1 venomous snake we have right immediately within this area. And when the symptoms you want to look for a snake bite include pain, swelling, tissue discoloration at the site of the bite. Sometimes you see puncture wounds, but not always, because sometimes that swelling can close down those puncture wounds and you may or may not see bleeding. If you do think your pet has been bitten by a venomous snake, seek veterinary care immediately to have them assessed and to discuss an appropriate treatment plan.
Okay. Someone is asking about the raw foods like Blue Buffalo and some other ones that are like that, and what do you think about them?
You say raw foods?
Raw foods, yes.
I do not recommend raw foods because of the risk of bacterial contamination for both you and your pet. Salmonella is a big risk in these raw foods. And when some people do raw food diets, they actually just do raw food diets from home, where they feed just the raw food with the bones, and then the bones cause problems. The pre-made raw foods still have a higher risk of salmonella, and that also is a risk to the family members as well. So young children, older people, immunocompromised people are at really high risk of developing bacterial infections from exposure.
Okay.
Even just from those dogs eating it and then licking the owners, or the fecal material when they pick them up or it's in the yard, definitely an increased risk of bacterial contamination.
All right. So she was here taking your questions. We've got all of these resources for you in the 2 Wants to Know section. We're going to post both of these interview segments so that you can see if your question was asked and then answered. Make sure you take a look in the 2 Wants to Know section.